Hello, I am Dr. Sunny Gugale. I am an orthopedic surgeon. I am a sports medicine specialist and a robotic joint replacement surgeon. I am practicing here since last 15 years. My Happy Joints clinic is in Pune Swargate area. Today, I am going to discuss with you all an interesting topic which is known as knee preservation or biological knee restoration. We have seen a lot of issues about knee replacement, a lot of issues about knee osteoarthritis, a lot of things about sports injuries. And now, in today's era, there is a certain need and a sudden surge of a lot of people to have undergone some treatment for their knee problems at a middle age to avoid the knees getting damaged in future. And these treatment strategies is known as knee restoration or knee joint restoration surgeries. After we have seen a lot of things about how to take care of your knee at a middle age, how to avoid these knee problems in future, and how to take care of your joints and bones well, we need to also know about certain surgical procedures that can be done at a middle age in order to take care of your knees and keep your knees preserved as it is so that they don't get worn out faster or rapidly. These surgical procedures are known as knee preservation surgeries. Most important treatment in this is known as high tibial osteotomy. If you are having genu varum or genu valgum, which is bow legs or knock knees, then you did not have to worry about. And if there is an pain and discomfort starting at a middle age, the X-ray and the MRI shows that the inner side of the knee joint is getting worn out, then you need to correct your knee alignment. You need to get your hip, knees and ankle in a straight line, and these surgeries are known as high tibial osteotomies. They can be done at a younger age in order to make your knee last longer. Other group of surgeries which is known as partial knee replacement, in which you don't change your entire knee joint but just change the affected area, which is the inner side of the knee joint or the outer side of the knee joint or your kneecap, that is the patellofemoral joint, and you can take care of your knees at a younger age. So these surgeries are more biological. In these surgeries, we don't cut the ligaments, we preserve all the ligaments, we just change the damaged part of the knee joint, and it is more natural. The patient's perception about the knee is more natural. The knee behaves more naturally as the ligaments stretch and strengthen and elongate during your knee activities. There are certain other groups of surgeries which like ligament repair and reconstruction, meniscus repair and replacement surgeries, and these are very important to have a good and a stable knee joint. So a lot of treatment strategies have been introduced in order to recreate your knee structure. If you have a sports injuries in the past and if they have been neglected for a certain period of time, then you need to undergo certainly known as ligament reconstruction surgeries in order to avoid your knee joint getting worn out faster. Nowadays, there have been a research and a recent advances going on cartilage preservation and cartilage regeneration. So everything, the entire world is behind identifying and isolating treatment strategies for your knee joint cartilage. If you have focal injuries in your knee cartilage, then you can do something known as ACI surgeries or MACI surgeries. This is known as autologous chondrocyte implantation or matrix related autologous chondrocyte implantation. So a lot of techniques have been evolved and a lot of strategies have been involved. Though these surgeries are being recently done from last few years, we have seen a lot of promising results for these patients, and definitely they have a role to play if you are having knee cartilage injuries in your younger age. There is something known as stem cell therapies. Even these are in a vogue now. So what we do is we take certain stem cells from your body which are derived from your blood or which are derived from your adipose tissue, that is the fat, and these blood cells have a good potential to differentiate themselves into cartilage forming cells, and these are known as chondrocytes, and these are then injected in your knee joint. They are cultured in the lab and then injected in your knee joint, and they help your knee cartilage to grow more in areas where it is deficient. But these group of patients are very specific and they need to be identified at a younger age. Knee preservation surgeries will be for a certain age group and not with those who are having advanced knee arthritis, where you have obvious deformities, we have obvious bow in the legs, because at such times these surgeries are not going to help and they will be just a futile exercise. So at this point, I want to leave you all with a message that if you are at a younger age, between your 30s and your 40s or early 50s, then you are having knee problem from a short period of time, the knee is not very bad, please ask your doctor about knee preservation surgeries, about these knee preservation strategies, and get an insight on it in details. In my future videos, I am going to detailedly describe each and every surgery in depth so that you can understand the pros and cons of these surgeries and take a appropriate, well-informed decision. Thank you.